far and everybody just assumed I didn't do my hair. I just let them think that. All right.
And to be honest, no, I didn't do my hair today. No.
Oh, you didn't have to be honest. We don't need that much honesty. I'm sure you look gorgeous. So thank you, everybody, for joining us today. Please, if everybody would use their phone or another browser window to log on to polleverywhere.com/Pi Day. So it's POLLEV.com/Pi Day. That'll allow us to get some feedback during the meeting. And then after the meeting, we'll have an evaluation up there for you to respond to also, so we can get some feedback. Please feel free to use the chat function. Carrie's going to be monitoring that for me, and just to make sure that we capture everybody's thoughts. Also, feel free to unmute yourself if you have something to say that you want everybody to know about. Please actively participate, otherwise it'll get really boring just listening to me talk. And then please ask questions and let us know what you need. That doesn't only go for today's webinar, but it goes for every day in the network. So some people already responded to how you're feeling. Thank you for participating. I'm going to clear my response and change it. So thank you. Some people are still feeling yuck. I hear that. I think a lot of people just feel but I'm glad nobody's feeling sick. That's good. Sometimes I feel like meh is as good as we can hope for these days. But I am happily surprised that most people are feeling pretty good today, and we have some extra super happy people. Whoever put the extra super happy marks, can you share your secret? Can you unmute yourself and tell us why you're feeling extra super happy on this sunny day? Anyone? You guys aren't going to tell me who you were, who was extra super happy?
I am.
Oh, tell us why, Laura.
I'm not really super happy, but I've been feeling meh for a couple of days, so I just decided, all right, I'm tired of feeling meh, so today I'm going to feel super happy. So
mind over matter. I like it.
Yeah, we'll see if it works. We'll see.
Anyone else who said that they were super happy today? Nobody wants to admit it and rub it in. All right. Well, I hope that we all have something to feel, at least something, some sort of happiness and not totally miserable. So I think that we are recording this session today, and we are going to just have it for posterity, and then also to share it with people who were not able to join us today. We're going to start with some welcome and introductions, going around just so that everybody can know who else is on the call with us today. And because part of doing this network is that we can start to feel like we have a community, we have a learning community, we have people that we can call on. Some of you folks have been with the network for 7 years now, and so you know, some people know each other, but then there's been lots of turnover also. So there's new people that we might not have ever met before. And then we're inviting new people into our process this year who will be helping facilitate a lot of our sessions. So we want to take time to make sure that everybody feels welcome and connected and has some sense of knowing each other, since we can't get together in person. We're also going to just talk about the network and review the metrics from last year, just to level set and remind everybody how we got to this place where we are planning for this year. So gratefully, we got funded by McCormick Foundation to do some more capacity building for all of our organizations in our network. And then we're going to talk about immediate first steps, things that we're going to do after today's meeting. We have some Medicaid training videos that are available now, and our friends at ICOI are going to tell us how to access those. We're going to have a kickoff meeting for all those people who are utilizing the shared HR in August. So there's going to be a doodle poll sent out today so that all those people who want to talk about shared HR can have a session specifically about those issues and processes. And then finally, we're going to start a needs assessment in August with 2 different questionnaires that are going to be sent out, and we will talk about the purpose and reasoning behind those. So if you have any questions, please let me know. So we're going to start out with some introductions, and welcome everybody, especially if you're new. I'll start. My name is Tanya Rempert. I am with Planning, Implementation, and Evaluation org. I am Executive Director. I've been in this network for 7 years, since it was the Unified Outcomes Project with McCormick, where McCormick brought together 30 organizations who had like 60 different outcomes and 60 different measurement tools. And McCormick said, can we narrow this down a little bit? And so together as a group, we identified outcomes in 6 specific tools that could appropriately measure those outcomes. And so then since that time, we've been continuing as a learning organization. And then what I hope to gain from participating in this network is more capacity building. So whoever wants to go next, maybe Jen Loudon.
Hi, I am Jennifer Loudon. I'm the Director of Strategic Planning for PI.org, and I will be the new facilitator of the network this year, and I'm very excited to see what we can accomplish.
Laura?
Hi, I'm Laura Watsky. I'm the business director for PI. I am also handling shared HR this year and some other behind the scenes things. So I'm happy to help in any way that I can. So reach out.
And Carrie is the woman behind the screen. Carrie does a lot of work for the network, but I don't know that anyone's ever met her.
I'm Carrie. Hello. With PI, I am the Creative Analytics Director. I do data analysis, but for the network, I've been doing a lot of project management over the last year and helping Laura out. And this upcoming year, I'm going to have, I'm not sure kind of how the role is going to morph over the next year. So I've only been doing the network work, obviously, for as long as it's been in existence, so a year. And I'm just super excited to see how it develops and changes based on all of the learning we did last year.
I've been grateful that Carrie's been doing our newsletters for us, because I would not have been able to figure out how to do those on my own. So thank you very much, Carrie, for being technologically savvy. How about Jen Borgoni?
Hi, I'm Jen Borgononi with Team Parent Connection. I've been in the network since the beginning, so 7 years. What I always hope to gain from a network is just meeting people, learning from other people, and the capacity building, professional development. I've learned a lot over the 7 years.
Yay! How about Sarah Daniels? Sarah is new to us.
Hi, everybody. My name is Sarah Daniels. I'm a policy analyst with the Illinois Collaboration on Youth with a focus in behavioral health and Medicaid. I've only been with ICOI for a few short months. Actually, I started amidst the shelter-in-place order that was activated early March. So I've only been a part of the organization for a few short months. And what I hope to gain from this network participation is the amazing work that ICOI has done so far with the Medicaid Technical Assistance Center, and how the network can assist us with continuing to push that amazing work and just making sure that it continues to be advanced.
Thank you. How about Deb McCarroll?
Oh, look, I'm going to show myself. Hi. I'm Deb McCarroll. I'm the Director of Policy and Government Affairs at the Illinois Collaboration on Youth. And we are new and very excited to join this collaboration and network. And you're very fortunate to have Sarah working on this project, because she's a very bright, intelligent young lady and is going to do wonderful things for ICOI in the future. I think what we hope to gain is to be able to do the capacity building around Medicaid billing and understanding what Medicaid is in an environment where we know that Medicaid services are going to be needed more now than ever.
Thank you. How about Pam Kostecki? Oh, you're muted. Oh, can I unmute you? No, you're still muted.
Can you hear me okay? Okay. Pam Kostecki from the Crisis Center for South Suburbia. I'm really not sure how many years we've been in the network. I know I've been working with you guys for 3 since I've been here at the agency. And then we're very grateful for the partnership and all the support that you guys gave us. And I'm just excited to see where you guys are headed this year.
Ann, how about Ann Wells?
Hi, I'm Ann Wells from Children's Research Triangle. I've been in the network for 7 years since the very beginning. I'm like Jen. I feel like I've gotten a lot, and I'd like to, what I've gotten so far is, meeting other people and networking, and I'd like to continue to do that. So.
Well, you're always a great resource for us too, Ann, so thank you. How about Carrie Estrada?
Good morning. I'm Carrie Estrada. I'm with the Children's Advocacy Center of North and Northwest Cook County, not to be confused with the Chicago CAC, which sometimes happens. I've been in it since the beginning, so 7 years. And I've appreciated the networking and listening to different ideas, and I'm hoping this year we can get a lot of information about if it is feasible for us to develop a funding stream through Medicaid.
Thank you. How about Heather Milnick?
Hi, everybody. Good to see everybody. And I would echo exactly the same thing that Carrie just said. I've been in the network for 7 years. Appreciate the networking as well. And for us, yeah, we've just been on the fence about this whole Medicaid thing, I feel like, for years. And I just would like to get some just good direction around what do we need to do to finally make that decision. You know, I've asked around and there doesn't seem to be a good process just to decide cost benefit. Is it worth us taking that leap and getting into that funding stream? So I'm really hoping that that's what this year will bring about.
Me too. How about Colleen?
I'm Colleen Sunkis. Good morning, everybody. Director of Training and Education for Sarah Zinn. I'm not sure how long Sarah Zinn has been in the network. I became more involved last year personally with the professional development days. So I really enjoyed that, and thinking about what kinds of training would be interesting and exciting and useful to our partners throughout human resources, human services. So that had been my role in that. So I'm excited and hopeful that we do that again this year.
Great, thank you. How about Teresa Valak?
Hi, I'm Teresa from La Rabida. I'm the clinical director at our trauma center. And I believe we've been in the network longer than I've been in my position, so I'm not sure. I think maybe from the beginning, but I'm not sure.
How long have you been there?
Well, I've been there 8 years, but I've been the director for 3. So I wasn't keeping track of some of this before that. But yeah, I know we received McCormick funding for a long time, and then it switched over. We've been doing this and participating. I know my staff really appreciated, they did participate in a lot of the trainings this last year. And we've benefited in lots of ways, transportation and interns. And so we're just looking forward to continuing to work with the group. And we're also talking a lot about considering Medicaid funding. So I think this will be helpful.
How about Laura Zumdahl?
Good morning. I'm Laura Zumbal. I'm the CEO at New Moms. I'm sitting in today. My colleague Melanie Garrett usually is our representative as part of this, but she's on a much needed vacation this week. So I'm sitting in for her today. we've been part of the network for years, although I can't tell you exactly how many before we're in there. But similar to what a number of folks have already said, we are in this process of moving towards Medicaid. And so we are appreciative of being part of a network of others who are on that same journey and look forward to the learning and support from others along that path.
Thank you. And Jan Waters.
Hi, everybody. Dan Waters. I'm the Chief Program Officer from Chicago Children's Advocacy Center. And we've been part of, and I have been part of the network for the entire time, since 7 years. And we've appreciated a lot of the different activities that we've been able to learn from. And I would echo what other people have said. We also would be really interested in, we have been for a while flirting with the idea of Medicaid reimbursement, but we have not, have not done it so far because it just seemed like it was too complicated for our little our little administrative section. So, but it'd be nice to, I really would want to visit that again and see, because a lot of funders really are kind of eager for us to do that. So, yeah.
And how about Mary Navarro?
Good morning, everyone. Sorry, my video is not working. I'm due for a new laptop, so hopefully the next time you'll be able to see my face. But again, I'm Mary Navarro. I'm from Zacharias Sexual Abuse Center. We have 2 locations, one in Cook County and one in Lake County. We have been in the network for many, many years. I just started with Zacharias Sexual Abuse Center a year and a half ago, close to 2 years now. So I did learn quite a bit, networked quite a bit last year, and my hopes for this year are to continue to network with everyone who joins and to continue to learn. But my goal is to really kind of more or less try to connect with the grant makers of everyone's organization to become a little bit more creative of how to receive funds and so forth, especially during this COVID-19 time and other events that are taking place. So I'm sure that I will learn from each of you as you start to share, and that's it.
Thank you, Julia. Yeah, we're going to spend a lot of time doing strategic planning this year, and so grant makers coming together to talk about how to make our strategic planning come to life, in the upcoming years will be very beneficial. Thank you. How about Jenna Burbridge?
Hi, I'm Jenna Burbridge. I'm from Advocate Aurora Health in the Childhood Trauma Treatment Program. I am not sure how many years we've been in the program. I know I've been involved for the last 2 or 3, but we may have been since the start. I'm not sure.
Yes, you have, but you've been in for 2 or 3, so that's great. Okay.
Right. So I'm the train director, and then what we hope to gain, we just always appreciate the opportunity to network with other agencies, and then the professional development last year was really great as well. We are a Medicaid provider already, but only for youth and care, so it'll be interesting to hear, what else other people are doing with regards to that as well.
Thank you. How about Josette?
Hi, good morning. My name is Josette Carmona. I am the training director for Metropolitan Family Services. My role was new as of last September. So yeah, I just really was really looking forward to any professional development opportunities we have for our staff across the agency. I coordinated just the communication for our staff to attend last year's training. So we were really appreciative of those opportunities.
Thank you. And Carol Gall?
Hi, good morning, everyone. Carol Gall, Executive Director at Sarah Zinn. And to my knowledge, I've been here 6.5 years. I think we've been a part of the network since the beginning, 7 years ago. Meg Hefty, our Associate Director, usually has spent a lot of time working on the McCormick project. I think, I'm just continue to be excited about the professional development opportunities. I thought those were great last year. And then just learning from other organizations, especially as we are all navigating our new normal in COVID, and you know, looking at operations and programming and how people are navigating all of the ups and downs. So thank you. Good to see everyone.
Between Friends, hi.
Hi. I'm Molly with Between Friends. And I think we've also been with the network for 7 years. Is that, yeah, great. And we very much appreciate being part of this network. We're small, so it really helps us with capacity. Our staff really loved the professional development last year, and we appreciate the partnership.
Thank you. And who did I forget? Is there anyone on the call that did not yet introduce themselves? I think we have somebody on the phone. Oh, and then Julia Nubler also. Okay, hi.
Yeah, hi, how are you? I am Julia Nubler. I come from Children's Home and Aid. I actually am in the same boat with a lot of other organizations. I don't know how long we've been in the network. It feels like a long time. It seems relevant. And again, I just think that just, you know, taking advantage of the networking opportunities and some of the other initiatives that have been put forth. I know we have struggled with that because of COVID, and we lost some of the momentum from some of the initiatives that were going last fiscal year, and are hoping to, you know, recommit to our to our partnership.
Thank you. Thank you. Anyone else? Okay. Well, these are all the super smart people who are a part of our network, if you see on the screen here. Most of these organizations have been with us from the beginning, but like I said, there's been a lot of turnover, and so every year we kind of just like to do some sort of event for people to see each other's faces and get to know each other on a personal level, because we would really like for everybody to be able to connect and reach out. So after this call today, we'll be asking people about their contact information and what kind of information they want to receive from the network, but also if they want to be a contact person for the rest of the network. So that way we will put out a list of network contact people so that there can be sharing between networks, and you guys could reach out directly to each other and not feel like you have to go through me or anything like that. So that step will just be to facilitate partnerships and community building. So the purpose of the network has always been to provide capacity building services to organizations, even when it was the United Outcomes Project, right? It was capacity building for determining what kind of outcomes are relevant and what kind of measurement tools are appropriate. But then when McCormick changed their funding model and changed to only being network-based funding, the Unified Outcomes organization stayed together and applied for combined funding, and hopefully what we're able to do over time is be a capacity building organization that brings in funds even beyond McCormick and really helps spread up across those benefits and that capacity across all the organizations to be frugal, but also by collecting all the shared knowledge from across organizations to be better together than we are each independently and being solo, right? Like we're better together. And as you may or may not know, last year, 1920, was our first year that we received funding, and we decided that last year we would do a lot of professional development, and then last November of 2019, we got together with it seems like a lifetime ago, we got together with all of the leadership from the network organizations to say, well, what are the needs for this year? How should we apply for funding? Do we even want to continue being a network? Is this working? You know, so we got a lot of feedback about how to finish up the 2019 year from those folks, as well as what to apply for the grant funding for the future. So our role is to be the backbone organization, planning, implementation, and evaluation, tries to represent everybody's ideas at, you know, with breadth and depth, and help make sure everybody's needs are met. We try to facilitate communication between the network members and providers who are providing capacity building, as well as facilitate communication between organizations. When one organization is really doing something great that other organizations want to learn about, we want to facilitate you know, sharing that knowledge and sharing that experience. We hope that we could be supportive in any way, and so as this year goes forward, if you have ideas of further supports that PI can provide to your organization in particular, or the network as a whole, please let us know, because we really want to empower and build the capacity of every organization to do more good work for the most vulnerable populations in Chicago. The goals are to learn from one another, to collaborate with one another, and of course to improve the quality of our programs for the people that we serve. This is what we achieved last year. I don't want to dwell on the numbers, but just so that everybody can see this, we can share the PowerPoint later if you want to examine this slide in detail. But last year, you know, we had a lot of professional development. That's what a lot of our resources of time and money went to last year. This year, people said they wanted to shift and go to building capacity by revisiting our roots as a learning collaborative and sharing information with one another. And those fell into certain buckets that I'll cover in a minute. But we are going to be keeping some aspects of the shared recruiter. We're going to be keeping paid internships, and we're going to be keeping the option to pay for transportation for clients this year. So these are the buckets that the planning for this year falls into. These are the buckets that we kind of originally discussed in November of 2019, and then I had a lot of conversation with individuals after that to just kind of clarify what we meant and what we needed. So as I said, we're going to continue to have the shared HR resources. We're going to continue to have transportation funds. We're going to continue to have paid internships. If there are opportunities and a need for one organization to provide professional development to another organization, we are happy to facilitate that and to help make that happen. We don't have any topics right now that we're going to highlight in that, but that's certainly a direction and a concept of being a learning collaborative, right? So the new area for this year is that we are going to have a facilitator kind of do strategic planning and capacity building around technology. Specifically, the need that many organizations said that they need a better system for data collection systems. So we want to, you know, as a collective, learn about, identify what are our needs in that area, how can we identify what will meet our needs. And so instead of each organization going through this process by themselves, we'll go through it as a collaborative, and we'll be able to bring in experts. We'll be able to have time and space to reflect on different options together, and we'll have the time and place worked into our schedules to focus on this if this is a need for your particular organization. Also, a lot of organizations said that they are working on different ways to utilize technology for client engagement. When we first identified this need in November of 2019, we had no idea that COVID was going to hit and create a need for us to flip overnight to technology for client engagement but people were already in the works of trying to conceptualize the development of an app, etc. So we're also going to focus some of our strategic planning time and our learning collaborative on this topic of using technology for client engagement. And then what a lot of people are excited about, I heard in the introductions, is that we are also going to make time and space for learning about how to create a Medicaid billing system in your organization. And ICOI will be talking about that today and introducing how you can get started right away in learning more about how to integrate Medicaid billing systems into your funding streams. Finally, this is a area that McCormick is very interested in us doing, is supporting advocacy that is already going on within organizations and highlighting advocacy topics that organizations who do not have any outreach like that already built in, but that your voices are not lost. So we are going to have a stream of advocacy outreach specifically about the transportation funds. The organizations who have used transportation funds have expressed how useful it's been, and so we want to do some advocacy with our state public funders to highlight and show them evidence that of how the transportation funds helps clients fulfill their service plans, and find out if there is a path for us to get transportation funding covered by public funders. Also advocating and communicating with public funders about their updated information systems. Many of you who have been around a while remember that we had a panel discussion that Rebecca Levin put together from McCormick 3 years ago now with a lot of the large funders in the state of Illinois, and then it kind of didn't go anywhere. Chapin Hall did a survey to find out what the members of this organization wanted to see from the state funders, and then it kind of died down. So we are going to resurrect that project and communicate and see if we can pull some people together and just make sure that while the state is updating their information systems, that they are taking into consideration the needs of the people in this network. And then finally, Medicaid funding support. The ICOI folks are going to share with us later on in this presentation the different types of Medicaid funding support that they are going to be able to provide you as a member of this network. And without further ado, I will give it to Sarah. And Sarah said that she has her own slides that she wants to share with everybody. So I'm going to stop sharing, and Sarah, you can take it over.
Okay, thank you so much. And all right. Good morning again, everybody. My name is Sarah Daniels, and I would just like to thank you, Tanya, again for having us on the call today, as well as welcoming us to the network. So I'd just like to start by updating you all first and foremost on what the Medicaid Technical Assistance Center is. So for the last 2 years, fall of 2018, ICOI has been taking the necessary steps to establish this center and support, as a lot of you all have mentioned earlier, your desire to move to a Medicaid billing system in a social services and behavioral health sector. So one of the first things that we had done was started with a Medicaid managed care billing survey readiness, and in April of 19, we completed that phase, which released the readiness assessment, as well as the trainings, in-person trainings with providers to assist them with how they could start to bill. And what we did find out, sorry, I need to move you all on the side of this. What we did find out from that assessment was that 60% of our providers did not have a contract. And most importantly, a lot of them were small providers and serving predominantly, communities of color, and they were least prepared. So now currently the purpose of our partnership, and in addition to the purpose of the Medicaid Technical Assistance Center, we're piloting technical assistance resources, advocating to establish within HFS, as well as the Office of Medicaid Innovation. But our next steps will be to support HWN members to thrive in the Medicaid managed care billing environment. And our next initiatives would be building to learn electronic billing systems, how to submit clean claims, and then advocate for the network members to state leaderships through legislation, et cetera, as well as the managed care organizations to make the process a lot easier. And then the Medicaid Readiness Survey results, we did receive 132 responses that were worthy of analysis. And then this link will take you to a lot of our other findings of what the Medicaid Managed Care Survey findings were. And then in addition to the preview, revenue spreadsheet, FAQs, and MTAC updates. And currently we are working with Sage, which is a boutique healthcare firm based out of Chicago, where they assist healthcare providers with strategic advocacy initiatives. So they've worked with us being a trade organization, community-based providers. They've worked with lots of other across the sector to assist. So now we're hosting a 12 series live training session. We had our first one on Monday, so we're very proud of that. But the purpose of these trainings are to supplement the in-person trainings that were supposed to take place, but the virtual has been going pretty well. And Tanya, you can feel free to send this out to everyone on the call, but it is How to Bill Managed Care, a training for Illinois healthcare providers, online training modules, as well as the billing basics, which we have on our website as well, of the trainings that took place, which is a prereq of what these live training sessions are currently. And then the registration for the next one on the 27th is also on the website, so feel free to register for that. We will have live Q&A sessions, as well as we try to make it as interactive as possible, as I said, to supplement the in-person. So the topics are getting credentialed, setting up to bill, behavioral health billing, and inside the mind of MCO. So all of these trainings are gonna go on for 4 times over the next few weeks. And then currently, what ICOI is doing on behalf of our membership, we have a bi-weekly MCO HFS IMHIP meeting where we advocate regarding outstanding billing and claim issues with the MCOs. So we advocate and we step in and escalate if necessary. A lot of these issues have been, going on for quite some time. I will say it's safe to say for over a year. So just kind of keeping track on what those issues are and making sure that it becomes a lot easier on the providers moving forward, as well as the Medicaid billing systems. And then if you all are interested in advocating and helping understand what's happening, if you are in the becoming in the realm of dealing with Medicaid, as I heard a lot of you say, these are the people to contact to become a part of those meetings. So again, I can send this to Tanya. So the next step would be learning how to do the Clean Claims initiative. So we're going to be possibly working with Sage, who are currently doing our live training sessions on developing this clean claim curriculum, as well as the delivery of the trainings. And we did discuss with PI the deliverables would be the office hours learning collaboratives, where 2 will be in the fall, 2 will be in the spring. So the learning collaborative virtual meeting on what an organization needs to know would be how to submit a clean claim, managed care organization. But obviously we would recommend that you all do participate in the YouTube trainings that are up on ICOI's website, as well as try to get in some of the live training sessions to kind of play catch up, if you will. All right, and do you all have any questions for me? I know I kind of ran through that fairly quickly, but do you all have any questions for me that I could answer on behalf of ICOI in the Medicaid Technical Assistance Center?
Yes. Can you be really clear on how people can access the virtual trainings that already exist on my understanding is that you already have virtual trainings on how to bill Medicaid managed care and how to get credentialed for billing Medicaid. So how do they access the virtual meetings that already exist and the training sessions that already exist that they can access right now? How do we tell them, like?
So the modules can be found on our website, how to bill Medicaid managed care, right? It's going to be attached to this link here in the slide. And there'll be, I believe, 12 modules, I'm sorry, on the website that'll take you directly to YouTube. And it's the in-person sessions that occurred back in February. And then
where is the link? I'm sorry, I don't see the link. Like, is there a www link?
Yes, give me 1 second. Okay, I need to pull it up so I can.
Maybe we could drop the link into the chat so people could.
Yeah, I can do that. Give me 1 second.
Thanks.
Okay, so while I'm finding that, the training that took place on Monday, we actually did a recording of that. So we sent that out to everyone who would have registered and attended that session. So we do have that readily available for I can send that one to you all too. Are there any other questions while I find this?
I'll just throw in a little feedback. First of all, it's awesome for me that ICOI and McCormick are partnering up, because we've been a part of both organizations for a long time, and so it's great that they're going to be working together. I actually watched some of the modules that are on YouTube and was at the meeting on Monday. And they're helpful, but I feel like, at least for us, like there needs to be a step before that, which is sort of how do we even make the decision of whether or not we're going to move forward with this. And I don't know, I'm hoping that's something that this partnership can really get at, is sort of like, what are the pros and cons, cost benefits of becoming a Medicaid provider. You know, for us, we know it's going to take significant financial investment even to become prepared to do Medicaid billing. We're going to have to, we don't have electronic medical record system at our organization. We don't have anyone who's familiar with Medicaid billing, so you're talking about possible personnel costs. What's the financial benefit? How do we even figure out, you know, how much would we even potentially be able to bill? So the trainings are great and they're helpful, but I feel like they're a step ahead of where at least we are as an organization. Yeah, Carrie's nodding. I know we've had conversations about it, like, yeah, a few other people too. Just to, you know, so I don't know if that's something, I'm hoping that's something that this network can do, is help us make an informed decision about do we take that leap or not.
Right. And that's a part of.
This is Debbie. Oh, I'm sorry, Sarah. This is Debbie. I would be really interested in hearing more about that. We worked really hard to develop this over the last couple of years, hoping to get HFS to stand this up inside its own system, because they can claim match on the administrative claim for this, all of this training. We have a steering committee for the MTAC work, but I would be really interested in having a conversation about what's missing from what we have done here, because we created this where nothing existed. We used New York as a model because they were the only one in the nation who was doing anything remotely like this. And so we sometimes forget, people don't even understand what Medicaid benefit could be or what it is or what it does. And we might need to back up a minute and create something that is more elementary about where the state is as far as managed care billing, where the state is on fee for service, you know, what kind of clientele you actually have. Are they Medicaid recipients? Are they not? How do you, am I touching what I think I hear you saying?
Yeah, absolutely, Deb. Because I mean,
Carrie
we
shaking her
know,
head.
yeah, we know that like, I mean, 80% of our client population pays the minimal fee for our organization, and many of them have Medicaid coverage. We just have not gone into that space because again, we know that there's a lot that we would have to do to be ready to do that, and we've been kind of held up by, we don't know how to make that decision. We don't know what, you know, what is the financial, is it worth, is the cost of getting to that point worth the benefit? And moving forward, we're thinking probably it is, as more, you know, funding becomes available or becomes directed towards Medicaid eligible clients. We just don't know. We're not going to do all those things and then find out, well, we can only bill, you know, 10% of our clients or 10% of our services or whatever. So I'd be more than happy to have a longer conversation with you about, you know, how do we do that?
And how we do that, Tanya, in this network, I'll let you guys figure that out. But I mean, that would be a really good conversation for Sarah and I would like to loop Andy into that conversation too. She couldn't be on today to talk about what's missing here. Where should we have started from where we did start? And I'm sorry, again, Sarah, you were going to say something.
What's there is great, you know, and I think that if we were already in that place, I'd be like, oh, this is awesome. Now I know how to do this, or I know how to get credentialed. I know how to make the claims and that kind of thing. I just, you know, it's just the step that sort of assumes that we're already at that point of doing that. We're at the step before, which is making a decision about if we want to get to that point. So, but what the trainings that are there have been very interesting and I think well done.
All right, thank you. I look forward to that conversation.
Yeah, for sure.
Yeah, I just want to add to all that 1,000% everything that they just said, as well as something that we struggle with. I mean, I've had jobs where I've done Medicaid in the past and like even was a Medicaid auditor and like got people online. So like I get that whole process, but that piece about, you know, we are funded a ton on grants. So, you know, we're not looking to like double dip and get sued and all of that big nightmare. Like, how do you keep those programs separate? Or are we bringing on Medicaid just so I could start this whole new therapy program as a funding stream to do that? So it's like these like even when I say it out loud, it's like that seems so rudimentary, and also we need help in being able to do that. Figuring
well, it's not rudimentary by any means. I mean, so I've been doing this work a really long time, and we started about 8 years ago discussing the behavioral health system and the reform that needed to happen for children in the state, and trying to. There was a very long conversation that just now is starting to take root about divesting behavioral health services on residential facilities and opening up community-based mental health centers or behavioral health clinics to allow DCFS residential facilities to diverse their funding streams instead of being totally tied to the DCFS world. And also it also solves some federal Medicaid problems, but you know, opening up a clinic that then serves the residential facility out of that clinic, and then it gave those residential facilities an ability to expand their service delivery system and provide services in the community. But it's not cheap, and EHRs are very expensive, and if you're a small entity, you're going to have to think about collaborating with other entities, even to hire a full-time FTE person to do the billing. Right. Because you can, right. I mean, you gotta form a network, and yes. So I'm happy to have more of that conversation. Yes.
Awesome.
Sarah, did you find a link?
I did. I realized I sent them privately first, but the slides are there, the recording is there, as well as how you can access the YouTube videos that took place earlier this year.
We'll also include them in a follow-up email to this.
Yeah, I can make sure that the links are properly in the slides. I do apologize. Again, we did make our last-minute edits, but I can resend you that slide deck if you want to send that out to everybody.
So I appreciate everybody's feedback on, you know, what we can get from ICOI and making sure that we get the most bang for our buck out of the Medicaid Billing Learning Collaborative. And as you heard, they're just as much interested in learning from our network as we are learning all of the knowledge that they have gathered and put together. And so we are going to also have live Q&A sessions with them. And so we can make sure that we schedule one of those sooner rather than later. So that way, you know, you can do your assessment of, is this worth our time diving in deep to, and then also utilize all of the virtual trainings that they have already developed, and then having follow-up Q&A sessions also at the end. So it'll be very, interactive and be able to have your specific organization's questions answered.
And I did, sorry, Tanya, to cut you off. I did also want to mention for these training sessions that are currently in place, we are developing an FAQ. So all the training, all the questions that are coming through the live training session boxes, we are making sure that we transfer those and receiving answers for those as well. That will take some time, especially after analyzing the recordings, but that is in the process as well.
Does anyone have any questions about the recorded trainings and or live Q&A sessions with the Medicaid Facilitated Billing Center? All right. So I am going to then introduce Laura Wadsky. She is, how do I share? Many of you may already know Laura because she was a big coordinator of all of the professional development sessions last year, and she worked closely with Pat to make sure that Pat was meeting people's, HR needs last year. And since the funding for the network, got cut in more than half, so we're not going to have Pat on staff this year. We're not having somebody on retainer, but we are still able to pay for some shared HR work. And so Laura is going to share that with us. She's worked with PI for several years and is happy to support all of your good work. She does a lot of administration, a lot of problem solving and communications for network members. And so she's looking forward to helping everybody now with their HR needs, specifically the smaller organizations who might not have somebody dedicated to HR. So that way, we could all benefit from the collective. And, if you want to hang out with Laura, she's a great person. She enjoys hiking and cooking and stuff. So Laura, you take it out, take it from here.
Thanks, Tanya. Well, I'm looking forward to the new year of the network. I thought that last year we did a lot of good things, and I'm anxious to take what we learned last year for the pilot year and kind of go forward. So even though Pat Belka won't be working with us this year, I did work a lot with her last year. And so I will continue in the shared HR recruiter role for the second year. Hopefully we'll be a little bit more streamlined. We'll take what we learned from last year and move forward. This role functions, the biggest function of this role is to fill open positions within the network organizations. So I know many of the organizations, many of you post job openings on your own website or else on other websites, and so that's great. That can continue, and if you don't need my services, then that's fine. But if you want to continue doing that, but then also use this role to supplement your own postings, then we can hopefully cast a wider net to help get a broader audience for you as you try to fill open positions. So today we're just going to do a brief overview of what we did last year. there are kind of 3 different ways that we worked at filling open positions. The first was for internally through the network. So we would share openings through emails that were sent out directly to organizations in the network. And then also we did post some openings on newsletters that were sent out pretty much on a monthly basis. So we will continue with that. So if at any time you have an opening that you want me to share out to the other organizations, then we can do that. We will continue to utilize some job sites. So the network is covering the monthly costs of us having several slots on some different job sites. So we've posted on ihiresocialservices.com, and then we also have some slots with npo.net. So we plan to continue with those in the future. So if you have an opening, just send it to me through an email, and I can share that on those job sites. And then also, lastly, we worked at building some connections through higher education. So we have a list of local colleges and universities that we have posted jobs with. So I'll continue to reach out to them, and they can post jobs on their job boards, or several of them use things like Handshake or Simplicity Network. And we also just have direct email contacts at different universities. So we will continue to use that so that they can share the jobs out to their students and alumni, so that you're reaching those specific, that specific audience as well. So for those of you who either receive all network communications from the organization, or who have received, or from the network, or who have received emails specifically from the recruiter last year, I'll send a notice out to you about a doodle poll that we'll try to do in August, just so that we can all have a quick chat, get on the same page, see, go over what the process is as far as sending openings to me, and how I'll go about posting those. And then if there's anything else that you would like to see help offered in this role from the shared HR recruiter, then we can talk about that as well. So any questions? Okay.
Thank you, Laura. So now I'd like to introduce Jen Loudon. Jen has recently joined PI as our Director of Strategic Planning. She's worked as an independent consultant since 1999, providing comprehensive outcome measurement system development and program evaluation and strategic planning expertise to a variety of nonprofit organizations, as well as public funders, as well as state organizations. Before that, Jen spent a decade at the Chicago Public Schools in their strategic planning department, and then she moved on to be the founding executive director for social and emotional learning at CPS. She was responsible for designing and implementing innovative practices citywide that dramatically improved students' emotional and mental well-being. Jen's current projects include several small Chicago nonprofits, several large national nonprofits, NFPs, and 3 Illinois state health and human service agencies. Jennifer has lots of awards, specifically the Joseph E. Zins Award for Early Career Achievement, and she holds a master's degree from the University of Chicago SSA. And interesting fact, her 15 minutes of fame came in 2016 when she spoke at the Democratic National Convention on nomination night. She enjoys hiking and travel, and I think that everybody should take some time to go stay at her cabin in Indiana. It's lovely, and a great place to get in touch with nature during quarantine. So take it away, Jen.
Thank you. Hi, everybody. I'm really excited to be joining you. It seems like a really tremendous opportunity to bring extra value to the network in this time when we all have to innovate strategically around COVID. So I will be helping you think about and facilitating the process of capacity building throughout the year. So I always like to start with the end in mind, which usually means I'm asking myself a question, right? So how will we build capacity, and what could that mean? Our first 3 steps are sort of laid out here. One, we want to certainly start by listening to you and what you need. So in August, we'll be doing an agency needs assessment, getting one response from each agency to sort of identify which capacity building opportunities will be most valuable for your organization. Obviously, we've already gotten a good start this morning in terms of some of the feedback that we've gotten so far. We'll also do an individual interest survey. So for those organizations that have more than one employee participating in the network, we want to make sure that we figure out who wants to participate in what aspects of communication, capacity building, etc. So we will also be doing that in August as a separate survey process. And in September, we'll be working on a consensus plan using all that survey data to come up with a strategic plan on how to use the resources this year to build capacity for the network, as well as determine sort of the best method for doing that. So the year-long plan is really separated into 3 phases. First is needs assessment, which you just heard me talk a lot about. Figuring out, listening to you and identifying specifically what your capacity building needs are, reflecting on strengths and areas improvements, and making sure we have baseline data for our next step, which is synthesis and learning. We'll synthesize the shared needs across the network and identify key resources within the network or key personnel who could support the kind of baseline learning we need to sort of enter into phase 3, which really should say capacity building. So essentially we want to start by building a foundation of knowing what you need, figuring out what kind of learning we need to put in place so that we can engage in capacity building for the last 6 months in phase 3. So the first steps, or the immediate next steps, we will work on needs assessments in August to determine the focus for this year. We'll identify 1 point person per agency. And in addition to that 1 point person, we will make sure we have desired areas of knowledge and participation for every person in your agency who may be participating in the network. And that is sort of the rough outline of the plan for this year. So with all the information that you've received today in very short order, I'm going to ask you to toggle back over to your polev.com/Pi Day window. And if you don't have one open, please pop one open. This is sort of the mini beginning of our needs assessment process. Let us know what you still need and what you need to know. And there's a way on the Pole EV window that you can pop right over and do that. What do you need prior to our next engagement? And what do you want to learn more about? So take a few moments and be as specific and detailed as you can, because we'll mine this to really contribute to the August needs assessment and use all of that as a foundation for moving forward. And we'll give it a few more minutes and then we'll take a look at your responses. Carrie or Tanya, are you able to show the responses? Thank you. Thanks, Deb.
Polev.com.
Okay, more about the recruiter opportunity process and how that works. Thank you. More information about Medicaid and HR. Continue funding for transportation. Yes, as Tanya mentioned, that will continue. Learn more about Medicaid funding. Okay, sounds good. Any PDs that will be occurring this year will really be determined by the needs assessment process. So make sure that you use that August needs assessment to really articulate what you would like to see for your organization. Yes, we will work hard to make sure that we are clear on which meetings are focused on which topic. We can maximize strategic participation from your agencies. Data collection systems, a lot of HR recruiting. More information about a point person. Tanya, do you want to take 2 minutes to address that? How should they decide who their point person is going to be within the agency?
So we'll be more clear about it on the questionnaire. And you guys could give me your feedback. Oh, oops. One way to do it is that there is, one point person from each agency. The way that we did it last year is that everybody in the agency can determine what type of communication they wanted. And so then there was, within each organization, they decided, okay, we don't all need to be getting the same emails. So really organized person who always responds to emails and always has a clean inbox, you should be the point person for the network, and then let the rest of us know what to do. And so if that's what you want to do at your organization, that your organization picks a point person to receive all network emails, and then that person decides who in the organization, gets which emails, that's fine. Or I think another way of thinking about it is a point person for each activity, right? So there might be one point person who is the point person for the learning collaborative around increasing client engagement using technology. That might have one point person. Or there might be 3 people at your organization who are already using that. And so you'll want all 3 people to get all of those emails. So hopefully the way that we have designed the questionnaire that you all will be receiving in August will be very clear about that, asking you who should be receiving which emails. And so at your organization, you can decide if that's one person receives all the emails, and or if specific people receive specific emails about specific topics. Is that clear? I mean, feel free to unmute yourself and tell me if that's crazy.
Tanya, this is Mary. I think that's a really great idea. I know that kind of communication works in our organization, so great idea.
Okay, good. Glad I'm not crazy. Thanks. It was an option. So anybody who didn't realize, you can actually vote on Poll Everywhere to kind of like upvote other people's comments. And so when you are looking at your screen, you can push the up button if you want to vote on that one, that is something that you also need to know. And you can load the other responses to see them, and then say, yes, this is something I also agree with. This is something that I need. So if you say load other responses and then scroll through them, you can upvote the items that you also agree with that other people may have mentioned. And we will, of course, take all of those into account when we are sharing information going forward, specifically as a follow-up to this meeting, right? Like, what do you need prior to our next engagement? We'll make sure that we're clear about all of the options to participate, etc. Data collection systems, yay, my favorite topic.
Yeah.
Full menu, yes, we will be very clear on that following up today's meeting and how to participate. Wonderful. So you can continue upvoting on that for a moment. And this is the contact us slide. So as I said earlier, we will follow up with notes from this meeting, as well as the recording, as well as the PowerPoint. And in the PowerPoint, here are the links for how you can contact us about any specific questions. So you have Sarah Daniels. Sarah, wave for everybody. And then we have Samantha Fry, who is also on the Medicaid Technical Assistance. She'll be helping us out. And then we have Elena Kennedy from Medicaid Technical Assistance from the Illinois Association of Medicaid Health Plans. She will also be a resource for us. Laura, she's going to be sending out a doodle poll for anybody who is specifically interested in the shared HR activities. And then Jennifer Loudon is going to be taking over everything as facilitator to make sure that everybody's learning needs are met, and to make sure that we stay on target, and to make sure that we stay focused on developing quality work for, you know, Chicago's most vulnerable clients, and make sure that your learning needs are met so that your organizations can thrive, and that all of our capacity is built by being connected together through the network.
Yep. Very good summary.
Any questions about anything?
I see someone has a question about contact information for Deb McCarroll. Sarah, is that something you could drop in the chat?
I sure can.
Thank you. If you have any questions, feel free to unmute yourself, or you can use the chat.
Here you go.
Thank you. Okay. Tanya, you're muted.
If nobody has any questions and you go back to your poll everywhere, you'll see that there is a evaluation form where you can give us your feedback also, so that we can make sure that we're meeting your learning needs, you know, in every single meeting. And Jen, do you just want to one more time go over all the next steps and what everyone can expect from us, and then we can log off if nobody has anything else?
Yeah, please make sure you're on the lookout in August for two things coming from us. One, an agency-wide needs assessment, and two, a specific assessment for each individual in your agency about what aspects of communication and participation we should plan on for them. So we make sure everybody has the information they need as soon as it becomes available. And then we'll use all of that to build a consensus plan for how we move forward this year in September. And that will determine our action items, meetings, and the ways we engage in capacity building.
All right, then we can sign off. We got done early. Yay, we're so efficient. And I hope everybody uses the extra 10 minutes you have to do some stretches before you get on your next Zoom call.
Nice. Oh, I have one more thing. We will be, if you haven't submitted the logs, like the internship logs and the logs for the transportation, don't worry about it. We are going to reach back out to anybody who hasn't submitted in August. So just be on the lookout for communication from us then. And then this recording, we'll put it on the website. You're muted, Tanya.
Bye, everybody.
Bye. Have a good day.